This is Abia COVID-19 update.
Abia COVID-19 update.
Well, let's go straight to the discussion for the day. We're talking about the upsurge in infection and the need for protection with face mask. Today, I have joining me in the studio Dr. Azubike Onyebuchi. He's the Chief Medical Director of the Federal Medical Center in Umuahia. Good morning to you, Doctor.
Good morning.
Welcome to Abia State COVID-19 update.
My pleasure to be here.
Interesting time, I must say. It is for frontline health workers, for doctors and other health workers, especially at the Federal Medical Center.
It amazes me at the level of impunity by our people. Even as this second wave of coronavirus pandemic is ravaging the country, if you take a drive around the city of Umuahia, you will see that more than 98% of the people are not wearing the face mask. And in our risk communication to people, ways to prevent coronavirus, it's very clear. Make sure you don't contract the virus, and how do you do that? You make sure you wear your face mask so that those areas that you can the mucous membrane that the virus can go in are easily protected. You maintain social distance with anybody that is coming near you, and then you make sure you have a very good hand hygiene by always washing your hand with soap and water. And if you don't have that, you sanitize your hand with an alcohol-based sanitizer. These are the things that NCDC has brought out and that is working, the non-pharmacological ways of preventing COVID. And yet our people are behaving like core Trump supporters in America who don't even believe that.
You call it core Trump supporters?
Yes.
We have people that still believe COVID doesn't exist. Even when we have medical practitioners like yourself come on the program to tell them that COVID is real. We've interacted with some of the patients at the various isolation center.
That's why I'm likening them to call Trump supporters. You saw what happened in America during the election and even post-election. They are still not wearing face masks. The numbers in America is in the skies. The same thing that is happening in Nigeria. And if you've read about a history of pandemics, the second waves in every pandemic kills more of Africans. Go and look at the history. Go and read of history of all the pandemics we've had. The second wave kills more Africans, and yet our people are behaving as if everything is normal. It amazes me when you go out and you don't see people wear your face mask, just ordinary wear your face mask, and nobody's obeying.
Doctor, it's even more worrisome now. Health practitioners are saying that the virus has mutated. The one we have in Nigeria has mutated.
Yes.
Can you confirm this?
There's a mutation of one of the strains in the UK that it's more deadly than the previous ones that we had in the first wave, and this one is rampant in the second wave, and it's now moving all over the world. Remember that a lot of our brothers visited from the UK to Nigeria for Christmas, and I'm sure they must have spread this variant, and I think it's been confirmed by one of our research institutes that particular variant is in Nigeria. And you can see that people are dying more. You see the numbers. Did it happen like this in the first wave? It didn't. And yet our people are not taking it seriously. I was burdened yesterday. That was why I called the Commissioner for Information and said, what are we going to do to enhance our risk communication for our people in Abia, so they will understand what is happening? COVID is not a scam. It's not any business. It is real. And our people should know this. The hospitals are overwhelmed. Everywhere is overwhelmed. Resources are overwhelmed. And God forbid if they do a second lockdown, this economy will crash.
Okay, I want to take you on that. You said the hospitals are overwhelmed.
Obviously, hospitals are overwhelmed.
The isolation center that you have at in your care at the Federal Medical Center, are you saying that it's filled up with patients?
At every point in time, it's always filled up. Now I'm talking to you, people don't understand the severity of these things. We've even lost some people at the Federal Medical Center from COVID. And yet people are not taking it seriously.
Interesting. Well, we are speaking with the Chief Medical Director of the Federal Medical Center, Umuahia, talking about Dr. Onyebuchi Azubike. He's very much in the studio, and he's been talking to us about the risk of you not making use of your face mask. Now, social distancing, is it achievable?
Why not? Why not? The interministerial committee brought out a lot of guidelines for ceremonies. You should not have more than half the capacity in the church service. If you're doing a burial, it should be smart and not more than 50 people. All those things are in tune in making sure that you have social distancing, because it's been proven by science that the closer you are, and the more you can have this virus getting into you, and we don't know who the virus is going to deal with. A lot of people are carrying it without being asymptomatic, but one person who has a comorbidity, either diabetic or hypertension or whatever, gets it, the person is gone.
Why are doctors not immune?
Why not? We're human beings. Every doctor is a human being created by God. So that you're a medical doctor, you should have the knowledge. You should have the knowledge. But sometimes in a bid to save life, sometimes you might just forget, those personal protective things that you wear in a bid to save life, and you contract the virus. And if your immune system is not strong, or you have some comorbidities as a doctor, obviously the virus will also deal with you if you don't get help.
Has any doctor contracted COVID at FMC?
A lot of doctors have contracted COVID in FMC, but they've pulled through. We've never recorded any deaths from any health professional in FMC from COVID, but a lot of our health care professionals, nurses, doctors, all the healthcare professionals, some of them have contracted COVID, and I have the list in my office.
Okay, I'm going to get back to the risk communication, doctor, this morning, but let's talk about your welfare. It is very important.
Yes.
Frontline health workers are the soldiers at the front line fighting the battle against COVID-19 in Nigeria. Are you okay with what you're getting right now?
Well,
as far as the welfare and the hazard allowance is concerned, I know you're very particular about the hazard allowance.
I'll leave that to the unions. I'm a public officer, so I'm not supposed to criticize government openly. I leave that to the unions. But all I will say is that it can be better.
Interesting. It can be better. Now let's talk about the safety of the doctors. What have you put in place to ensure that those doctors are well equipped? Talking about their PPEs, did you provide? Are they provided as at when due, so that they won't contract COVID-19?
Let me put it on record that the federal government has supported us tremendously in procuring some PPEs. Just late last year, we were giving some money to procure PPEs for the hospital community, which we have done, and then we are systematically distributed to the health workers to make sure they're protected. That is our job. That is the main thing we have to do, to make sure that the workers who look after these sick patients are protected. And I'm sure if you go to FMC, they will tell you that the management is doing its best in making sure they are protected.
Let's talk about the state of the isolation center at FMC. We have two major isolation centers in Umuahia, to be precise, one at Amachara and the other one at FMC. That's you're in charge. What is the situation? How are the patients doing? How many bed spaces do you have there?
Okay, we have a 5-bedded holding area where you keep patients who are not sure of their results, but are having those symptoms that look like COVID.
You quarantine them.
Yes, we keep them there as a holding area until we get their results. Once the results are confirmed and it's positive, then we transfer them to the isolation center. Presently, we have a 50-bedded isolation center built by the Abia, a group of Abia professionals to help the hospital and the state in building capacity in managing such infections. So we are doing our best to make sure that patients survive. But like I told you, we've lost one patient from COVID
at
this year at FMC. This year. And we're doing our best to make sure that the ones that get admitted get the best care. And remember that this care is basically free of charge.
Upon arrival at the isolation center, what type of symptoms do they present with?
It depends on the patient. Some people just come with severe breathlessness, fever, cough. Some people come with derangement of their comorbidity, like if they were diabetic, you see the blood sugar going very high. If they're hypertensive, you see the blood pressure going very high and all that. But the underlying thing is that their COVID PCR result is positive, and then you have to manage everything, including the comorbidities. It resources into the resources of the hospital. But I mean, there's nothing we can do. That's our mandate as a tertiary hospital, to make sure that patients who have COVID are managed well and then eventually nursed back to life.
It's more worrisome that some private facilities in Abia State are treating patients for malaria and typhoid, which is very common in the country, instead of checking for COVID-19, checking their COVID-19 status before admitting them. I don't know, what would be your advice?
My advice to every doctor who is running a private clinic is that he must maintain a high index of suspicion. If someone is coming down with symptoms of malaria or what they call enteric fever, that's typhoid fever, please, he must insist that patient gets a COVID test. The COVID test is free of charge, and you just get to the Amachara center or to FMC, and the samples will be collected and sent to the testing site in Amachara, and then the result will come out within 24 hours. So you're sure what you're dealing with, because the risk is that if you lose your guard and you're managing for the purpose of managing you're managing malaria and typhoid, and you contract the virus, you're going to spread it to your family will spread it to other people, and you just keep going around. So we must be the people, educating others. And once you have this, please, you must flag the person for COVID and let the test be done. It's better to be negative and you're treating something you don't know. So that's my advice to them.
It's better to be negative than you're treating something you don't know. I will like to get opinions right now, and of course your questions or contributions on this point of the program. Abia State COVID-19 update 0808 182 6949 or 0811 605 2949. I've got something to say to our tricycle operators in Umuahia and also Aba. For profit making, you're collecting 100 naira from your passengers, and at that, even at collecting 100 naira, you're still in disobeying the protocols put in place by the government, still having 3 passengers at the back and 1 in front. Well, it's not good. I think you should change for your safety. Very important. Let's get questions. We have a medical practitioner in the studio this morning. Your questions on COVID. We have the Chief Medical Director of the Federal Medical Center, Umuahia, Chief Doctor. Sorry, I'm about giving you a coronation.
I'm not a chief.
Dr. Azubike Onyebuchi in the studio. Hello, good morning to you.
Hello, good morning.
Yes, we can hear you. Good morning to you. What's your name?
Is this a COVID-19 update?
Yes, it is. It is.
Hello?
Yes, we can hear you loud and clear. Ignore your radio and listen to you through your phone.
Yeah. You were saying something.
What's your name? What's your name, please?
Is very free.
What is your name?
My name is Chris.
All right, Chris, go on.
Yes. I am calling from Abia State.
Go on, please.
Yes. Please, I had the talk saying that the COVID-19 test is free.
Yes, free of charge.
We can hear you. Can you ignore your radio and listen through your phone?
Yes, sir. Yes, I'm hearing you.
Okay, go on.
When my friend went to do the corona test at Port Harcourt, they collected 52,000 naira, which I have the remitter.
Okay.
I need to ask you a question.
52,000 naira.
Is it from?
And he paid cash.
Is it from a government accredited NCDC lab? If it's from a private lab for the purpose of traveling out of the country, I think there's a different policy on that. If it's for the purpose of traveling out of the country, there's a different policy of that government has with some private labs, and they charge money for that.
Okay.
But once it's for the purpose of the public health importance to Nigerians, and you go to an NCDC lab that is within any government setting, it's free of charge.
All right, thank you very much. Hello, good morning to you.
Hello?
Yes, we can hear you loud and clear. Good morning.
Hello?
Yes, we can hear you. Good morning to you. right, we have to move on. Hello, good morning.
Hello?
Yes, good morning to you.
Yes. I'm Chief calling from Afugri.
All right, Chike is here.
About federal medical centers and amateur. Why would it take it 24 hours, within 24 hours for a test to come out? In as much that this sickness or this disease is something that needs urgent attention. Why would it take within 24 hours for the result to come out?
All right, thank you.
Yeah, the turnaround time could actually be better, but I'm just giving you the most it can stay for the result to come out. It can come out under 6 hours. It's and it depends on the volume of testing that you're doing. So if they want to release them as a batch, and it can be that. And if someone or if a facility says, "Hey, please, we need this urgently," obviously the turnaround time can be less than that, very much less than that.
Hello, good morning to you. Hello, good morning. 0808-182-6949 or 0811-605-2949. Hello, good morning.
Good morning.
Good morning to you. Can you step away from your radio set to avoid the hallback? Thank you. I'm sorry, I have to let you go because of the hallback. Hello, good morning to you.
Hello, good morning, sir.
Yes, you're welcome.
Yes, this is Chris. I called back. I didn't get notification on what you said. The travel stuff. Yes, my friend wanted to travel outside the country.
Exactly.
2,000 naira.
Yeah.
When I went to pay 25,000 for students, then
That's the point I was trying to let you know, that if it's for the purpose of traveling out of the country, in terms of your having a negative COVID PCR test before you travel, you have to pay for that, and that's a government policy, and they have arrangement with several private labs to do that. But I was saying that if it's for public health importance, you will not pay any dime for your COVID test.
Hello, good morning to you. Hello, good morning. Yes, good morning to you.
good morning, sir. I'm also the one that called later about the from Afugri.
All right.
Now, even at 6 hours, is 6 hours not too much for a test to come out? That means there is no medical equipment for this in Abia.
No, that's a wrong impression. No, that's a wrong impression. That is a wrong impression. It needs to be processed. It doesn't just, it needs to be processed. It's a technical test. It's not just like a normal blood test that you get and you run for MP or enteric fever. If you understand what a PCR test takes, there are processes, and those processes must be followed, even for the safety of those working in the PCR lab. So it's not like a normal test that please.
All right, Dr. Onyebuchi Azubike, thank you very much for your time this morning in the studios of Abia State COVID-19 update. We do appreciate.
Thank you.
You're welcome. He's the Chief Medical Director of Federal Medical Center, Umuahia. The program returns tomorrow, but it is very important that you keep staying safe. Very, very important. Use your face mask. Very, very important as you're stepping out. And if you don't have any business outside, I think you should stay at home. Just stay at home. Right. Thank you very much. Many thanks to the partnering radio stations, BCA FM, Flow FM, Vision Africa Radio, Buzz FM, Family Love FM, and Real FM. My name is Michael Oni.
This is Abia COVID-19 update.
Abia COVID-19 update.